Statistics show that 4 out of 10 American men experience significant hair loss by the age of 35, and approximately 60% of women have to cope with this issue at some point in their lives. In many cases, hair thins because of genetic factors, but sometimes illness is the cause. In the latter case, the hair eventually regrows, but inherited hair loss is harder to treat. For both genders, thinning hair and bald patches of scalp cause embarrassment and loss of self-esteem, but while balding men can choose to take treatments or live with their baldness, few women are comfortable appearing in public with receding hairlines. 1. Medical lotions. For hundreds of years, various lotions have been promoted as effective remedies for baldness. In the majority of cases, the sellers have been either naive or outright dishonest, but today creams approved by dermatologists are available. Minoxidil is the best known of these lotions. It is recommended that women massage the 2% version to their scalps while men can use the 5% version. This treatment has its side effects in terms of itchy and dry skin, but users should see its effect in the course of 3 to 6 months. 2. Prescription medications. Traditionally, treatments for baldness usually consisted of various kinds of creams and locations, so it comes as a surprise to some of us when we find out that there is actually a pill that men can take to make hair grow. It was originally developed as a treatment for prostate gland problems, but the scientists noticed that it also encouraged hair growth. Almost 20 years ago, the Federation of Food and Drugs (FDA) approved its use as a hair growth stimulant. Today it is marketed under several brand names. This drug is unsafe for women of childbearing age. 3. Vitamin supplements. In some cases, hair loss could be linked to a lack of certain vitamins. Biotin, or vitamin H, is one of the most promising of the vitamins in terms of stimulating hair growth. Many years of research provides evidence that it really does help in this area. Biotin is found naturally in walnuts, bananas, mushrooms and a number of other foodstuffs, but diabetics, in particular, might not get sufficient amounts in their regular diets. Just as healthy people need a certain amount of biotin, excess amounts can have side effects. Biotin supplements should only be taken after consultation with a doctor. 4. Hair transplants. Developments in medical techniques enable both men and women to take advantage of hair transplant techniques unavailable to previous generations. This surgical procedure is carried out under anesthesia. The surgeon removes healthy hair follicles from parts of the scalp where the hair is abundant to transplant them in areas of thinning hair. Some claim that as many as 4/5 of women with thinning hair benefit from hair transplants. On the negative side, there are risks of scarring, and treatments might cost as much as $15,000. A very attractive wig is much cheaper. 5. Laser hair stimulation therapy. Recent progress in laser technology has led to the introduction of laser treatments to stimulate hair growth. These treatments are based on the fact that hair loss can be caused when hair follicles cease to be active for some reason. They stop growing new hairs, and soon the hair thinning becomes apparent. Laser therapy can increase the flow of blood to the follicles and so activate them to produce new hairs. Dermatological clinics offer laser treatments, but it is also possible to buy special laser combs and brushes and do your own treatment while carefully following the manufacturer's safety instructions.